Hi, Galveston. It's Teen Health Talk time, and I'm Dr. Beth Offlander, and I have two amazing colleagues of mine in the virtual studio today. It's Ray Medine and Emily Giffen, two of our social emotional learning specialists at Galveston Independent School District. And Ray, can you tell us where you're typically housed?
Yeah, I am housed at Ball High.
And Emily?
I'm at Collegiate Academy.
And I came to know both of you through this really cool initiative we call Causeway Galveston, which is this partnership between Teen Health Center, Family Service Center, UTMB Center of Violence Prevention, and GISD. And together we're bringing our resources and staff together to promote social emotional learning and mental health support in schools. I wanted to bring you guys in today because I think the work that you do is so vital during this time, and wanted to be able to create that space for you to describe it. So let's get started. Emily, can you describe what social emotional learning is?
Sure. Social emotional learning, it consists of 5 competencies: self-awareness, self-management, social awareness, responsible decision-making, and relationship skills. And so when we teach SEL, we dive deeper into each of those competencies, and it's just a powerful tool and skill set to have for everybody and anybody, the children, adults. We can all really benefit from learning about SEL and practicing it.
So they're kind of life skills.
Mm-hmm.
And I think about these skills right now as a psychologist as coping skills for difficult situations to promote resilience, what we call resilience. And Ray, I know you've done a lot with resilience. So could you describe what that concept is, what resilience is?
Yeah, so resilience is the ability to bounce back from obstacles quickly. A resilient person finds ways to cope with stress and anxiety and things like that. But also, a resilient person uses self-care techniques, in their life to help with those things.
Sure. So that the resilience, even though you go through all this distress and anxiety, you might experience that, but you still are able to manage through it all.
Yes.
And I know you guys have been teaching these skills through lessons, as well as working with the teachers to teach kids about these skills. But now that we're not in the school, how are you bringing these skills and competencies to families and in their homes?
So at Collegiate Academy, during the year, we would do advisory lessons, SEL culture talks. And so I'm still providing those to families, and those are found on the collegiate website. And so students and families can access those lessons and do them together. Also, I've had feedback from teachers who said, thank you so much. I'm using this at home with my spouse and kids, and it's going great. So that's been really cool to hear. Some of the lessons have activities for the families to do. So one Friday we did the chalk challenge where, because we're all quarantined right now, to get outside and exercise. And so whenever people are walking in the neighborhood or things, they see positive messages written in chalk from people. So that was the challenge, to get out, write positive messages. And we had some great feedback around that. And Dr. Auslander, I know you also participated in that. So that was really cool to see.
Yeah, and tell me one of the positive messages that you saw that really resonated with you.
Just something simple as keep going. It was like, yeah, okay. So
Don't
it just
give up.
resonated with me.
Right, cool. And Ray, can you tell us something that you've been doing to bring families some of these lessons?
Yeah, for sure. So my family, every day we do an activity called Good Things. Your kids should be very familiar with Good Things because they do it in school also. But Good Things is activity that allows people to share good things that happens to them. So with sharing good things, optimism is built, and which is optimism is also a component of resilience. So the way it works is everyone gets an opportunity to say, 1 to 3 good things that's happened to them in their day. Everybody listens, but what's most important is that everyone's just kind of free just to kind of say what their good thing is. So there are no wrong answers.
Yeah, well, that's really neat. So what were some of your good things?
So since it's pretty early still, so far today, one of my good things is that my 2 younger children just came downstairs like they do most mornings and just got on their laptop computers and just started working. They log into their school assignments and they just get everything done, and that's less stress and worry, on my wife and I. So that's always a good thing when they can just come get their stuff done.
Yeah, I think it's really great that you guys are doing that with your family, because I think, we really need those positive experiences to promote sort of our mental health. And I agree with you that optimism is preventive at this time and protective. So I really want to thank you guys for coming in today and sharing some of the great things you are doing. How can people learn a little bit more about what you're doing, by the way? Where can they go?
Okay, so one way people can learn more is by checking out the district update. So every week the district sends an update, and on that update there's lots of things happening in the district. But also Causeway Galveston has a section in that district update in which we send out tips and videos and SEL activities on there for families to do. So that's one really good way to get involved with SEL.
And then also we have a Causeway Galveston SEL Facebook page, and on there we post a lot of activities and resources and different things for families to use as well.
So what I'm hearing is optimism, resilience, don't give up, use your SEL skills to get yourself through.
Yes.
Okay, well, wonderful. Thank you guys for coming in today and joining us. We look forward to hearing more about the work that you're doing. And join us next time on Teen Health Talk. We will keep this connection and conversation going to help you cope. Thank you.
Bye.